So let's talk to someone who knows firsthand, of course, then the difficulty, the struggle that comes with this particular type of cancer, and also the fact that you're a nurse, Irmina, the fact that you can talk about it on the other side of the fence as well. Were there any particular challenges that you faced as a result of the pandemic? And in telling us that story, perhaps you can tell us a little bit more about your diagnosis and how you came to know that you were a patient.
Yes, I would like to say that sense of isolation, I think, was the biggest challenge during the pandemic, going through the diagnosis and the treatment without the support of family and friends, feeling like a prisoner in my own home, not being able to go out, distract myself, again, even going to the movies or anything really, shopping, just to take my mind away of the darkness of the diagnosis and treatment would help tremendously. But because of the restriction put by a government and due to fear of catching COVID, I was stuck at home 24 hours a day, 7 days a week for 6 months, which was just, I don't think anybody can understand how hard it was. I was all alone in hospital bed after a major surgery, not being able to see anybody, nobody to hold my hand, not getting a hug when it's the most needed, was awful experience.
It's obviously,
I don't think awful is a strong word enough.
I can hear it in your voice as well. It's obviously really impacted on your quality of life at a time when you were fighting for your life as well. And I think that's a sort of a double blow, isn't it? It makes it that much harder that you don't have that support, the loving support of your family and friends around you to be able to, as you say, just do a simple thing such as hold your hand.
Don't get me wrong, the staff in the hospital was brilliant. The nurses were amazing, the doctors were amazing, but they can't replace the loving person next to you.
Would you say that there's been any particular element of your care that has been particularly supportive or helpful then? Perhaps because you haven't been able to have friends and family around you, perhaps it has been the staff who've been...
Funny enough, the measures put by hospital to keep us safe, even though they make me feel isolated, for example, staff wearing a mask all the time, or the spaces between patients, so we couldn't really chat, everybody was like sitting on their own. On one hand, it made me feel isolated, but on the other hand, made me feel safer. So those measures were actually a good thing to be put in place. The mask wearing, the spaces in between.
And I guess that's another reason why women who are nervous that something might be wrong, that's another reason why through the pandemic they've been nervous about going to their GP or just doing something as simple as that, because they just don't want to go into any kind of a healthcare environment where they would be at risk of catching COVID.
Well, I can tell you my story. I was actually working on a ward night shifts because of the pandemic. All the surgery stopped, so all the staff was moved to work on a ward, and we were working night shifts. Therefore, my symptoms, which was fatigue and lack of appetite, I blamed change of shift patterns. I blamed the change of environment. I didn't think this is something to be concerned about. Then when my symptoms did got worse, again, I didn't want to go to GP because you could never get the GP appointment. They were just too busy. And when I did ended up in A&E, eventually, they wanted to send me home. And it was actually my fiance, my partner, who insisted for me to be seen on that day when I had my ultrasound, and then I was admitted to the hospital. I don't want to even think what would happen if he didn't insist, if I went home that day and waited for a GP appointment.
And can you remind me of the stage of your ovarian cancer?
Yes, it's stage 3, very aggressive carcinosarcoma, sorry, ovary. It was spread to lymph nodes. I had a major surgery removing all my reproductive organs and several lymph nodes. Then I had chemotherapy, 6 cycles every 3 weeks of 2 chemotherapy agents. And then I found out that I'm BRCA positive, and I was offered the maintenance treatment, which is working brilliantly for me. And everything is going great, and I'm happy, and yeah.
Yeah, thank you so much. I mean, I'm truly humbled by your experience and what you've gone through, and delighted that you're here to share it with all of us now, and so that everyone else can learn from it as well. I mean, I'm assuming, Irmina, and correct me if I'm wrong, let's move into the next stage of this conversation about it. Had you had an earlier diagnosis, perhaps your treatment plan would have been different, and things would have just been different overall. I mean, early diagnosis, as we've heard, is absolutely crucial to improving outcomes. Early diagnosis was already bad before, as we've talked about. It's now even worse in the wake of COVID. So with that, Clara, I wonder if we can come to you then. Do you think that at the moment there is a good enough level of understanding, of awareness of the public of biomarker testing, for example, or of the signs, the symptoms of ovarian cancer?
Right, so I'll take that in 2 parts. So in relation to awareness of signs and symptoms, I would say there's great scope for improvement. We know from, again, our Every Woman study that 90% of the women who were diagnosed, or rather 2/3 of the women who were diagnosed, said they had no knowledge or very little previous knowledge of ovarian cancer prior to diagnosis. So we must never take our foot off the awareness pedal. It's such an important campaigning activity for all of us, the awareness message. So I think that awareness is definitely an issue that we need to continue to work upon. And absolutely, we need to, raise awareness of ovarian cancer on all levels. So awareness of symptoms, awareness of the need to act quickly. We need to make sure that clinicians are aware of symptoms and the tests that they need to do, and make those referrals quickly as well. But increasingly, and it's an encouraging picture, there have been advances in ovarian cancer and ovarian cancer treatments. And we do know that, when you know more about the genetic profile of your ovarian cancer or your own genetic makeup, that actually now is a very powerful tool. So we must, there was a time when people would say, awareness raising, there's not much point to it because really there's nothing we can do anyway, and that's never a good enough excuse. But that argument is no longer valid. There are things we can do. And just from the point of view of women being well enough to tolerate some treatment, of women being able to enter into clinical trials, which is where the advances get made. So if we don't improve and increase the number of women who are being diagnosed sooner, we are actually denying them really fundamental opportunities to improve their outcome. So It's essential.
And I mean, interesting for me that, Irmina, you mentioned that it was fatigue and loss of appetite that were the obvious first symptoms for you. I wouldn't have known that. So, and I'm, relatively kind of like, well-educated woman about town, as it were. So that's really fascinating to me, that just something as simple as that, it wouldn't have initially sparked a kind of like, I should go to the GP and get this checked out, because it could be ovarian cancer or the early stages of it. I mean, Tracie, on that point, are there not just misconceptions, but factual errors that are out there in terms of the dialogue that's in the public domain right now?
Yeah, Hannah, I think there is. I think one of the things that we often hear women say is, I think it's IBS, irritable bowel syndrome. So it's such a non-specific collection of symptoms. So as Irma said, fatigue, and change in appetite, pretty non-specific. Add in a widening of your girth. Now, people put on weight in COVID because they didn't go out, because we couldn't go out. Add in a change of our bowel habits. Well, let's normalise that too, because we couldn't go out, so we couldn't exercise. So those as a collective are the symptoms that we know, and Clara's nodding because she and I know that. The problem is, as you identify, Hannah, they're kind of non-specific. So my big sort of mantra is those symptoms that aren't normal for you, it wasn't normal for Irma, that continue for more than 3 weeks, go and check it out with your GP. I'm not my normal. I've got something changed. And it's that collection. It could be 1 or 2 of the symptoms. It could be all of them. But go and get checked out. And I know Clara's nodding, and she and I have been, and the whole world is saying this. So it's really, really key. Subtle symptoms, and it's not bothering your GP. I can tell you GPs would much rather go, do you know, actually, we found some other reason. But I started off the top of this with IBS, irritable bowel syndrome. It's so often put down to irritable bowel syndrome. The majority of women are diagnosed at the age of 50 plus. You don't start getting irritable bowel syndrome in your 50s. If you haven't got it in your 20s and 30s, it's not irritable bowel syndrome. So it's not a thing at that age. So yeah, whatever isn't your normal, go and see your GP.